Today's topic is herpes. So herpes is caused by herpes varicella zoster virus. Herpes simplex virus type 1 is the most commonly causing causative organism of cold sores. It can also cause genital herpes. But herpes simplex virus type 2 is the usual cause of genital herpes, but it can also infect the mouth. So they're both one way and then another. Now, disseminated herpes zoster is defined as more than 20 skin lesions outside the affected dermatome. So what are the symptoms? Prickly sensation in the genital area, small sores that gradually blister and open up and become painful. The blisters then heal, dry, and disappear without leaving scars. Flu-like symptoms. Some women may also notice vaginal discharge. Swollen lymph glands of the groin are evident in some cases of herpes. And some people experience painful urination. Symptoms recur 4 to 8 times a year. Complication: when it affects the eye, there is pain and discharge. Pregnant women with herpes tend to pass on the infection to the newborn at the time of the delivery, and the painful lesions are evident on the newborn skin. Birth-acquired herpes may lead to very serious complications that include seizures, encephalitis, problems related to the nervous system and the brain. Disseminated herpes: if the herpes virus has spread all over the body, then it is called disseminated herpes. Disseminated herpes shows symptoms of complications of the kidney, liver, respiratory tract, and nervous system. Complications: apart from the painful blisters that accompany the birth, acquired herpes are cyanosis, lethargic appearance, tendency to bleed more often, possibility of seizures, decreased body temperature, decreased appetite. Symptoms may vary from simple to severe. The initial outbreak is seen with the appearance of blisters that erupt and dry in a few weeks' time. There are other symptoms like flu, fatigue, and loss of appetite. Now, when herpes throughout the body, it is called disseminated herpes, and the severity of symptoms can lead to death. Transmission: to cause infections, herpes simplex virus must come in contact with genitals, mouth, eyes, open sores. Sexual transmission: pregnant women can transmit to the fetus. Now, if the patient has an oral lesion, you should ask about sore throat, increased salivation, loss of appetite, and mouth pain. Primary episode causes fever, malaise, enlarged lymph nodes. But if it's not a primary episode, they are tingling, itching, painful sensation at the site of the lesion. Now, if the patient has a genital lesion, obtain a detailed summary of sexual activity, number of partners, barrier protection, oral or anal intercourse, history of STDs, burning with urination. Inspect patient's lips, oral mucosa for lesions or inflammation. Inspect the genitalia for lesions or discharge. Treatment: antiviral drugs inhibit virus replication and may suppress clinical manifestations. Acyclovir provides initial, recurrent, and suppressive therapy for genital HSV. Oral acyclovir has been shown to be effective in suppressing herpes in immunocompromised patients with frequent recurrent infections. Begin the use during a prodromal period. Treatment: administer famciclovir or valciclovir for recurrent episodes of genital herpes simplex virus. Herpes simplex is treated with topical 1% trifluridine. Now, in pregnancy, the use of antiviral agents as well as cyclovir and acyclovir has been shown to be safe. Many patients may require narcotics to relieve severe pain from the lesions. Treatment is a magic mouthwash. So when the patient presents too late in the course of the disease for antivirals to be of significant benefit, they may be offered to patients with recurrent outbreaks for symptomatic relief. Some of the examples of mouthwashes: fluids. Patient education is important. Patients with genital herpes simplex virus infection should be encouraged to inform their current partners that they have this infection and inform future partners before initiating a sexual relationship. Sexual transmission can occur during asymptomatic periods. Patients should be advised to abstain from sexual activity when the lesion or prodromal symptoms are present. Patient education is important. Latex condoms, when using consistently and correctly, can reduce the risk for genital herpes when the infected areas are covered or protected. Okay, so varicella. Varicella is also known as chickenpox. Is a viral infection in which a person develops extremely itchy blisters all over the body. An acute, highly contagious disease. Symptoms include itchy vascular rash, usually starting on the scalp and the face, initially accompanied by fever and malaise. As the rash gradually spreads to the trunk and extremities, the first vesicles dry out. The disease may be fatal, especially in neonates and immunocompromised individuals. Complications: varicella zoster virus-induced pneumonitis or encephalitis. Group A, streptococcal infections. Following infection, the virus remains latent in ganglia, and upon subsequent reactivation, it may cause zoster or shingles. The disease affects mainly the immunocompromised individuals and the elderly. Mortality, risk of death is lower for children than infants, increases with age for adolescents and adults. Children less than 1 year is 6 to 8 per 100,000, 1 to 14 years is 0.75 per 100,000, 15 to 19 years is 2.72 per 100,000, 30 to 49 is 25.2 per 100,000. Encephalitis occurs in older teenagers and adults in 1 per 3,000. 30% of the children with leukemia and lymphoma who acquire varicella have severe infections, and the mortality is 21%. Transmission is via droplets, aerosol, or direct contact, and the patients are usually contagious from a few days before onset of the rash until the rash has crusted. Prevention, vaccination, school omission. Recommended for all children between 12 and 15 months of age and between 4 to 6 years of age. It's recommended for adolescents and adults who have not had chickenpox. 1 dose of the vaccine is given to children less than 13 years old, and 2 doses separated by at least 1 month are recommended for people 13 or older. Vaccination: yes, more than 1 year of age, varicella susceptible, no history of chickenpox, no contraindications. However, no need for vaccination if they're less than 1 year of age, if immunodeficient in household, if pregnancy, mild natural chickenpox. How to care for your child: do not give aspirin. Daily baths with clean clothes will prevent the blisters from becoming infected. Keep the child's fingernails clean and cut short. Have the child wear cotton mittens at night or socks in the hands at night to prevent scratching. Try not to break the blisters or disturb the scabs, or they may leave scars. Ways to relieve itching is: most children get irritable and cry a lot. Apply calamine lotion. Dress your child as you normally would. A baking soda bath will relieve itching. When to call the doctor: temperature above 102, chickenpox blisters look infected. A chickenpox blister is very close to the eye. Child's ears begin to drain and the child complains of pain. Itching is so intense that your child cannot sleep. Your child begins to cough. Your child has improved and then has sudden repeated vomiting. Sudden tiredness or problems with his or her balance. Shingles. So what is shingles? Shingles develops on its own in a person who's already been affected by chickenpox. Technically, shingles is not contagious, but again, the person who has been affected by the chickenpox virus may develop shingles at a later part of the life. People who stay at risk of contracting the infection are those with a weak immune system due to illness like HIV, AIDS, injury, or other reasons. Older adults vulnerable too. Many main precautions for shingles are to avoid coming in contact with the shingles affected patient until the open sores heal. Once the sores crust over, the disease does not remain contagious. Symptoms of shingles early include headache, light sensitivity, flu-like symptoms, no fever. Then they have itching, tingling, or pain where a band, strip, or small area of rash may appear several days or weeks later. May appear anywhere on the body, but it will be on the side of the body blisters that scab and clear over a few weeks. Gloves and gowns while treating the patient. So we're looking at the precautions now. thorough hand washing procedures before and after dealing with the patient and limiting any transfer procedures of the patient. Advise the patient to stay in a room with the door closed. Isolation precaution. In chickenpox, airborne precautions. Airborne transmission occurs by dissemination of either airborne droplet nuclei or dust particles containing the infectious agent. Microorganisms carried in this manner can be widely spread by air and may be inhaled or deposited on a susceptible host from the source patient. N95 mask should be worn in ventilation if possible. All staff that has not had chickenpox should be excluded from caring for patients with shingles. Hope you liked our video. Please do subscribe to our channel and keep coming back for more.